Dr. Hall here, continuing on with our first lecture on contraception, specifically hormonal contraception. And now we're going to talk about the three main methods that we have of CHC or combined hormonal contraceptive, which you'll recall means they contain both an estrogen and a progestin. The progestin is thickening the cervical mucus and preventing sperm from being able to get up into the uterus and fallopian tubes to fertilize the egg, and the estrogen is there to prevent irregular bleeding. So the first and, traditional method to get these hormones into your body is through taking birth control pills. So you take a small pill every single day at approximately the same time every day, although it doesn't need to be exactly the same. The efficacy is still good, meaning it still works, even if you take one in the morning and then the next day you take it in the evening. Pill efficacy for CHCs is still quite good. But it's best if you can take it every day at the same time because that also helps you remember and make it part of your usual routine. We usually recommend taking it when you shower or when you brush your teeth in the evening, pairing it with some other activity that you do every single day at approximately the same time because then you're less likely to forget. Pills usually come in packs that also have these kind of handy dandy days of the week, which can also help you not forget to take them. It's just like, oh, did I take my pill today or not? And you can look at your pack, and if, today is Thursday and the Thursday one still isn't taken, well, then you haven't taken it. So sometimes there are these rectangular calendar-like ones. Sometimes there are these circular ones with dials that you turn and you punch out the pills. They've gotten pretty creative with the packaging. So the standard way to take birth control pills, CHCs, is that for 3 weeks you are taking tablets that have both estrogen and progestin in them. And then the 4th week you take a placebo, and you'll see these pills are a different color. And placebo pills are pills that have no active hormone in them whatsoever. So we call them placebos. And the reason that they are there is to help you stay on track and continuing to take a pill every single day. Because we know that if during that 4th week you just stop taking pills entirely, you get out of the routine, you get out of the habit, you're more likely to forget and start up a new pack when due. So this 3 weeks on and 1 week off of hormones is interesting, as you'll know from reading the article John Rock's Error, and was initially planned and designed that way so that then after 3 weeks of having exogenous estrogen and progesterone, you have 1 week with no hormones. So progesterone levels fall, and when progesterone levels fall, either because it's the placebo week of your birth control pills or in the typical menstrual cycle when the corpus luteum degenerates because there's no pregnancy, whenever progesterone levels fall, the endometrium breaks down and sloughs off and you get a menstrual period. So the classic way to take pills is 3 weeks of active hormones, 1 week of placebo, during which you will have a period. And that can be reassuring to the person because they feel like, oh, good, I'm not pregnant because I got a period. But technically, it's not a real period. It's a progesterone withdrawal bleed. It's very different from a typical menstrual period, which in some ways is very beneficial. They tend to be lighter and less crampy than a true period, so to speak. But there you have it. So this is all of that information in text in case you missed anything or want to jot it down. The one limitation of pills is that it's hard to remember to take them every single day. In fact, in studies where they gave women special electronic pill packs that would record which pills were actually punched out and taken versus which ones weren't, they found that on average women miss 5 pills per month. We also, which is quite a lot, right? And these are women who knew that they were in a study on people remembering to take pills, right? And so we also know that more than half of people who have unintended pregnancies report that they were using birth control pills at the time that they conceived. So obviously forgetting to take your pills is a widespread and common problem, right? And it's especially problematic if you forget your pill 2 days in a row, or if you don't start the new pill pack on time. Those are the things that significantly increase your risk of getting pregnant. And again, this is that information in text if you need it. Oh, I do want to point out that although the women missed an average of 5 pills per month, when they were asked how often, they thought that they only missed 1 pill per month. Humans are terrible at this. We think we're much better at doing these things than we are. So they then developed a patch. So they thought, okay, let's try to get away from having to remember to take a pill every single day. And so they developed a patch, and the patch has the estrogen and progestin components in it, and they gradually diffuse and are absorbed into the skin. There's enough hormone in the patch to last for at least a week. So the way the patch is worked is you put a patch on your skin in any of the locations shown here. You leave it on for a week, then you take it off, you put a new one on for a week, take it off, put a new one on for a week, and then your 4th week you just don't put a patch on. So what's nice about the patch is you only have to remember to do something once a week instead of once a day. You of course have to keep track on the calendar so you know where you're at in everything, or use an app on your phone. But this can be really helpful for people who have trouble remembering to take a pill every day. There are a few disadvantages. One is that it only comes in this one strange color, which is almost no one's actual skin color. It also is something that could be visible and seen by a partner, and a lot of times people don't realize this, but sometimes in relationships the partner is abusive and controlling and doesn't want their partner to be on birth control, but yet the person at risk of being pregnant may very much want to avoid a pregnancy, and so sometimes that method being discreet and not detectable by a partner is really important. Some people get a little bit of irritation from the adhesive on the patch, so that can be a problem in some people. Another issue that occasionally arises is people who are athletes who sweat a lot sometimes have trouble. The patch kind of starts to peel off a little bit. And then finally, the last disadvantage of the patch is that the way it's formulated, the hormone doses that the person receives are about 30% higher than in the other CHC methods. So there's some concern that your risks of side effects or adverse events might be higher with the patch than with other methods, and so this method is a little less popular than it used to be. This is that information in text if you need to pause. Finally, the third method that we have for CHCs is the vaginal ring. This is a flexible ring that you kind of squeeze as shown here in the picture, and you insert it into the vagina and let go. It will stay in place much the way a tampon will stay in place. It does not need to be in any specific location. It does not need to encircle the cervix. There is nothing about its specific location in the vagina that is important for how it works. The way the ring works is it's filled with estrogen and progestin, and they basically just diffuse out gradually and are absorbed through the vaginal walls into the bloodstream. So it's just another way to get the same hormones into your body. The way the ring works is you insert it, and traditionally you leave it in for 3 weeks, and then you take it out and you have a ring-free week, and then the next month you start with a new ring. So there's enough hormone in there to last for at least 3 weeks, and we'll talk about how sometimes you can use it longer. So this is great because you only need to remember to do something once or twice a month, right? Put it in, take it out, and then the next month put a new one in. So this is even better than the patch. So this is a very popular method. You have to be comfortable putting something in your vagina and then hooking it with your finger and pulling it back out, which is not very difficult for most people. It can cause a little bit of discomfort for the wearer during intercourse. It's interesting, they asked the male partners of female-bodied people using the ring if they could feel the ring during sex, and actually more than 3/4 of them said, no, I don't actually even feel it, and the rest said that they could feel it, but they didn't mind it. It didn't bother them. For the person who's using the ring, sometimes it can be a little bit uncomfortable during intercourse, so you can remove the ring for sex, and then simply when you're done, you just rinse it off in the sink and reinsert it into the vagina. The key thing here is you can't forget to put it back in. right? So you're allowed maybe up to 3 ring-free hours per day maximum, right? But the rest of the time you need to be absorbing those hormones into your bloodstreams to prevent or to cause that thickening of the cervical mucus and maintain that. So you can remove it for intercourse. You just have to be super, super, super good about remembering to not just snuggle up and fall asleep. You need to reinsert that ring. One potential disadvantage of the ring is it can increase vaginal lubrication and moisture. For some people, that can be a nice side effect and a benefit. For some people, though, that can be annoying depending on where they started. Again, this is that same information in text form. So how do you use these CHCs? How do we usually recommend people take them? So there's 3 different methods. The traditional way is Sunday start, which means that you start taking the pill or using the patch or the ring on the first Sunday after the first day of your period, right? So if your period starts on Wednesday, then you start that coming Sunday. If your period starts on Saturday, you start the next day, right? So it's the first Sunday after your period started. It's not after your period ended. And so the reason this has traditionally been used is that it turns out this way, if you start on Sundays, you are less likely to have your periods on the weekends, which some people really like. It also, you're starting on a Sunday, so it works well on a calendar, just keeping track of things. And because you started with a period or soon after a period, there's a possibility that you might have a little less irregular bleeding in the beginning as your body is getting accustomed to the birth control. So that's one way to start them, is a Sunday start. Another is to do a first day start, to say, well, as soon as your period starts, start your birth control. So this is a lot less confusing. And again, you're kind of in sync with your cycle, so you might be less likely to have some irregular bleeding as your body is getting accustomed to the contraceptive. The final way to start CHCs is just as soon as you get the prescription. And this has the significant advantage of you don't have to wait for your next period to get started with birth control, right? So you're going to be protected against pregnancy sooner, more quickly. The potential disadvantage is you might have some more irregular bleeding in the first few months. You might get the period when the pill tells you that you're going to get the period, and you might have the period that you were going to have anyway. Although data hasn't really borne that out, but that's a potential disadvantage. So the important thing to keep in mind when you're first starting a CHC is they aren't effective until they've been used consistently for 1 week. So you are not protected against pregnancy until you have finished that first week of either pills or patch or ring. So if you have intercourse during that first week, you must use backup contraception, namely condoms, so that you do not get pregnant. You cannot rely on your CHC that first week. Now, in subsequent months, after your placebo, for example, you're fine. You don't need to worry about using a backup method as long as you're using everything on time and according to schedule, and you're not late starting the new pack or the new ring or whatever it may be. So just that very first time when you first start CHCs, that's when you need to use backup contraception for the first week. Combined hormonal contraceptives are very, very highly effective if taken perfectly. So if you take your pill at exactly the same time every single day and you never forget and you're never late, that is perfect use. So there is only a 0.3% chance of getting pregnant in a year if you are a perfect user of CHCs. For most people, perfect use is not a reality, however. So we also have this other data point here, which is typical use. So these are the people who are able to do it just absolutely perfectly, and this is most people. So when we study people who are using these methods over the course of a year, about 8% of folks get pregnant. And that shouldn't be a surprise to you, right? Because we talked about how with birth control pills, the average number of pills forgotten in a month is 5. So it can be really, really difficult for people to remember to take a pill every single day, to change their patch when they're supposed to, restart the new patch or the new ring when they're supposed to. So typical use effectiveness is less, right? It's about 92% effective, but that is still much higher than many other methods. Certainly, it's certainly way better than the non-hormonal methods, right? So condoms with typical use have a 15% pregnancy rate within a year. So CHCs, even if taken imperfectly, have an 8% chance of pregnancy. So our 3 CHC methods are pills, which you take every single day at approximately the same time, 3 weeks on, 1 week off, or the patch, 1 week at a time, right, for 3 weeks, and then 1 week off, which can be noticed by others and sometimes can be irritating or fall off, although most people it stays on pretty well. Or the vaginal ring, which you just put in and leave it in for 3 weeks and take it out for a week, which can increase vaginal moisture and lubrication, which might be good or bad depending on the situation. And you can remove it for sex, but you have to put it right back in afterward. And it's nice because you only need to remember something once per month. So those are our 3 different CHC methods, and in section 1D coming up next, we're going to talk about the benefits and risks associated with CHCs.